Today we're going to talk about care planning, and that is one thing that is kind of unique in our office is that every patient that comes in receives a care plan that is specifically tailored for them to meet their health goals. And that is so important. When you come into our office, if you were to ask or interviewed patients coming in and out of here throughout the day as to like, why do they come here to our office? What brought them in? What health issue brought them in? You would find that the majority of our patients come in for things other than back pain or neck pain. We have patients that bring kids in for digestive issues or immune issues, allergies, ADHD, anxiety. We have headaches, migraines, all these different things, and obviously back and neck pain and things like that too. But the majority of our patients come in with non-musculoskeletal issues. And the reason why we get the results that we do for all these different health issues is not because it's just luck or because we do a different technique or anything like that. It's because we give the patient a care plan. And when a patient comes into our office with whatever symptoms they're having, the symptom is not the problem. The symptom is the alarm that's going off in their body saying, hey, something's not functioning properly. So with our approach, with chiropractic care, we are not here to treat your symptoms. We are here to fix the problem and try and correct the issue as to why those symptoms keep coming off in the first place. I use the example with most patients where if the symptoms you're having, digestive issues, sinus issues, allergies, trouble sleeping, headaches, migraines, whatever, if those symptoms are like your body's alarm system going off, that would be the equivalent of the alarm in the building that you work in going off, the fire alarm, and the fire company coming in and just pulling the alarm out of the ceiling. The alarm isn't the problem. The alarm is just telling you that there's smoke, that there's a fire somewhere. So when a patient comes in, our objective is to find out why. Why are these symptoms happening? And what can we do through chiropractic care to help put the fire out, to fix the problem, not just adjust you a couple times until the alarm goes off, and then wait until the alarm comes back on and adjust you again, and just one big vicious cycle. And we hear that all the time from patients. That they utilize chiropractic care in that same manner. Well, my back, I usually throw my back out, every couple months. Well, why? Let's figure out why. Let's not just adjust you a couple times until the back pain goes away and then wait for the back to get thrown out again. Let's fix the problem and see why that's happening so that that doesn't happen down the road. And same goes for any of those symptoms that I just listed. So when a patient comes into our office, we go over their health history. We want to know, the more we know, the better we can help. The more stressors that you or your kid or your spouse or whatever in that history, the more stressors they've had in the past can oftentimes lead clues as to why you're having the challenge that you're having in the present time. So we go through that history in detail. The next step that we do in our office is we go through and we take scans of your nervous system. That is one thing, and we've done many videos in the past on this, is that as a chiropractor, I am not concerned about your back and your joints and cracking bones. I'm concerned with the spine because the spine protects your central nervous system. Your central nervous system, guess what? It controls everything in your body. It controls digestion. It controls the ability to sleep. It controls your muscles. It controls your senses. It controls the expression of anxiety and stress and tension and all those things. So if there is stress and tension on your central nervous system, then your body is simply not going to function to its potential. So with our insight scans that we do in our office, they measure how your nervous system is functioning. They measure stress and tension on the nervous system. They measure stress and tension on the neuromuscular system. And then we measure something called heart rate variability, which is a global measurement of how your nervous system is adapting to the stresses of life. Once we get all that information from the history to the scans, we put together a care plan for every patient that is designed not to adjust you until your migraines go away or until your anxiety goes away or whatever, but to fix the problem. What can we do to rewire, recalm, reactivate the central nervous system so that the body is able to function like it was designed to? And that goes back to our previous video of the 3 stages of healing that we talked about earlier this week. So once we get that care plan created, the care plan is different for each and every patient. But the thing that really gets patients the results that they are looking for to help them reach their health goals is time and repetition. Nothing in life that you're looking to correct or change or improve upon happens overnight. Okay? You don't go say, hey, I want to go to the gym and get in shape, and go to the gym 1 or 2 times and get in shape. You don't say, hey, I want to lose 20 pounds, and you eat a salad a couple for 2 or 3 meals and lose weight. You got to do it consistently and do it for an extended period of time to see the results. Another example is our muscle memory with golf. You say you have a golf swing and you have a bad habit in your golf swing. You don't have a golf coach or a friend or something say, hey, just try doing it this way. And then your body's just like, oh, okay, I'll do that for the rest of my life this way. It takes time and repetition for your brain, your nervous system, and your musculoskeletal system to be retrained, to be rewired, to be reorganized. And that is time and repetition. And that's where the beauty of the care plan comes into place. And it's like that for any profession in health. So, you don't go to a physical therapist and they assess your range of motion and say, well, let's just see you once. No, they give you a care plan. You don't go to the orthodontist with crooked teeth and they give you braces for a week and say, okay, there you go. No, it takes time, months, years of having braces to change the structure of your teeth, because it takes repetition. That's how the body, the brain, the nervous system, and the muscles learn, is through repetition. Chiropractic care is no different, and that's why we do care plans. And that's why patients get the results that they do. So if you're watching this video and maybe you go to a chiropractor already, but you're in that cycle of treating it like a symptom, maybe the chiropractor says, hey, uh, let's just see how it goes. Let's just adjust you a couple times. Let me know if you need anything. Whenever things hurt again, let me know if the problems come back up and we'll adjust you again. That is treating a symptom. If your goal is to correct the problem, please reach out to us. We're going to put a link in the end of the text here on this post that's going to take you right to our website and allow you to schedule a new patient appointment in about 30 seconds. You click on that link, it has a bunch of available new patient time slots. You click on that, schedule an appointment, and we would love the opportunity to explain how we approach care and how we get the results we do, and to see what your scans, what your history would lead us to create a care plan specific for you or your family. So thanks for watching this video, and please reach out to us, share this video. We'd love for everybody to hear what we have to say in this information. So thanks for watching. We'll catch you guys next time.